Good evening to all. How are you? I hope you are doing good. Today we discuss about the some questions of the DHA exams, previous questions that are asked by examiner in the previous exams. So we discuss some question here and questions that are very useful for your other prometric exams. So okay. So we discuss the examination. Start from here. First question is the nurse note an isolated premature ventricular contraction on cardiac monitor. Appropriate nursing action is to. What is the actual nursing action when the patient is suffering from the isolated premature contraction? Actually, here in this question, there is a main static word is a isolated. Actually, isolated means there is no frequently premature ventricular contraction. Actually, there is a only single ventricular contraction, premature ventricular contraction that are seen on your cardiac monitor. There is no ventricular contractions here. Okay, so isolated ventricular premature ventricular contraction are not a specific threatening condition. This is a normal condition. This is not. So there is no any type of the need of worry. So here is no any type of the special type of the treatment is required in this condition. So prepare for the defibrillation is not required in this condition. Actually, if the patient is suffer from the frequent premature ventricular contraction, then there is a more risk to develop the MI or any further deteriorating condition. What here the patient is only isolated premature ventricular contraction, so there is no any type of the life threatening situation, so no requirement of the any special type of the treatment in this condition. So here is no requirement of the defibrillation. Continue to monitor the rhythm because the patient is totally normal, and you can continue monitor the patient. Notify the physician immediately. There is no immediately or not any type of the requirement to notify the physician because there is no any type of the life threatening situation. Prepare to administer the lidocaine hydrochloride. Actually, lidocaine hydrochloride or xylocaine is a medicine that is administered in the frequent premature ventricular contraction. When the patient suffer from the frequent premature ventricular contraction, a patient PBC, then we also administer the medication is lidocaine hydrochloride. But here patient is isolated premature ventricular contraction, means there is no life-threatening condition. So we not administer any type of the med. This is a totally normal condition. So only we monitor and document the situation, and there is no need to any type of the worry. So I hope you understood this question. I hope you understood this question. Okay. Then our next question is, this is our next question. A client has developed atrial fibrillation and has ventricular rate of 150 beat per minute. Actually, when the any type of the condition, when patients suffer from the any type of the fibrillation or any tachycardia that are more than 100, then patient rhythm is disturbed. So if the rhythm is disturbed, then if the heartbeat is more than 100, then what happens? Actually, there is a less time meet for the relaxation of the heart. So there is not proper blood are accumulated in the left ventricle during the relaxation phase of the your cardiac cycle. So if there is a less blood is collected in the left ventricle, then cardiac output is also reduced. If the cardiac output is reduced, then there is a less blood are pumped by the left ventricle into the aorta. Okay. So what happening? Then BP reduce, means there is a reduction in the blood pressure. If the heart rate is increased abnormally, then what happen? If the heart rate is increased abnormally, or when there is a patient suffer from the any type of the fibrillation, then there is a less time is meet for the your left ventricle for relaxation condition. So there is a less blood are collected in the left ventricle to pump out from the left ventricle. So there is a condition is developed is hypotension condition. Okay, there is a flat neck pain is a normal. Actually, in the normal person, there is a flat neck pain. There is no there is no engorgement in the flat in the neck pain. If there is an engorgement or any type of the dilation in seen in the neck pain, means in the jugular vein distension. If there is a jugular vein distension seen, then this condition is arise in the your right sided heart failure. So this is not directly related with the your ventricular rate or your atrial fibrillation. Okay, and nausea and vomiting is not meeting the criteria of the. Actually, these are not directly related with the your heart condition. Hypertension and headache not occur in this condition. Actually, here blood is not particularly pumped by or properly pumped by your ventricle into the your aorta. So patient is suffer from the hypotension, not from the hypertension. I hope you understood this question. And your next question is, yes, this is your next question, please. Okay, this is your next question. So you provide your response fastly. A client is admitted to the hospital for the evaluation of the recurrent run of ventricular tachycardia and is scheduled electrophysiology study. Which statement should the nurse include in the teaching plan for this client? Please choose your correct answer regarding the EPS, means electrophysiology study. What is the electrophysiology study? If you understood about the electrophysiology study, then you choose the correct answer regarding this question. Please fastly. Actually, electrophysiology studies are the study in which your electrical system, means your electrical current system are evaluated by your evaluated by this study. That in your heart the electrical activity is normal or any problem in your electrical activity, but this is not a ECG. This is a different procedure than ECG. In the this is an invasive procedure. Actually ECG is the non-invasive process, non-invasive procedure in which we only put the electrode on your chest and your foot or your hand, but not any type of the invasive procedure in the ECG. Directly we check the electrical current or your electrical activity of heart by placing the electrode in the ECG. But electrophysiological study means EPS. In the EPS we introduce a wire in the heart, and before introducing this wire, patient required NPO, because this is a invasive procedure. So patient require the NPO, like when a patient going in the general anesthesia. So same like patient is required NPO for approximately for 4 to 6 hours. And then actually here, if patient taking the any antidysrhythmic medications, so all medication required to stop before 24 hours to perform this test, EPS. So actually we especially differentiate or especially identify the situation of the your heart electrical activity, how your electrical activity of heart is, the NPU for the 4 to 6 hour. You will continue to take your medication until the morning of the test. This is absolutely wrong because you stop the antidysrhythmic medication before 24 hours. Second option is you will be sedated during the procedure and will not know what happened. Actually, there is no special, there is no requirement of the sedation. Okay, okay. I will check screen. Wait for 1 minute, please. Okay, 1 minute, please. Okay, now screen is visible. Is the screen visible? Yes. Okay. Okay. This test is non-invasive. No, this test is invasive, in which we introduce a buyer to check your electrical activity of the heart. So, right answer of this question is the test use a special buyer to increase the heart rate and produce the irregular heartbeat that cause your sign and symptom. So you check by your electrical activity by introducing the heart, introducing a wire into your heart. So this is a totally invasive procedure, and we require the stoppage of the anti-dysphoretic medicine before 24 hours of this test. Okay, and we also keep the patient NPO for the 4 to 6 hours. What is the right answer? Please read. Please read the question and give your right answer. Yes. An anxious client enter the emergency department seeking the treatment for the laceration of your finger. Actually, if the patient have laceration in the finger, then patient come in your emergency department and take the treatment. The client vital sign are pulse. If you check the pulse, then you found 106 beat per minute. Pulse of patient is 106 beat per minute, and the blood pressure is more blood loss in your body. Then to compensate this condition, your body also increase the pulse rate. Okay, in pulse rate, but BP decrease. If there is a hypovolemia or if the hemorrhage condition occur due to any type of the accident or injury, then there is a increasement in your BP and increase in your pulse rate. But what if both increase, then this indicate your sympathetic nervous system activation. If your sympathetic nervous system activation, your BP also increase, your pulse rate, your respiratory rate, all are increased for the compensation or by the sympathetic nervous system. If you reassure, means if you to calm down the patient, then if the patient calm down with the timing or with the situation, and with the when the patient is familiar with the healthcare worker, then their sympathetic nervous system is settle down, then there is a slowly there is a decreasement or of your heart rate, your BP, your respiration, cleansing injury, reassuring the client. When you reassure the patient that this is not a major injury and this type of the teaching. Autonomic nervous system are divided in two portions: sympathetic nervous system and parasympathetic nervous system. In the sympathetic nervous system, adrenaline is responsible. So this system is also known as the adrenergic nervous system. Okay, or parasympathetic is regulated by the acetylcholine. So this system is also known as a cholinergic system. Okay, I hope you understood about this question and be going to next question. And our next question is, a electrocardiogram, chest X-ray, and computed axial tomography scan are prescribed for the client who has activity intolerance. A patient suffer from the activity intolerance. When patient is unable to perform the activity are intolerated by the patient. If you want to perform these tests, then you firstly test those are easy to perform. Means firstly you perform the echocardiography, chest X-ray, and then perform the computed axial tomography. In this first option is CAT scan and chest X-ray in the morning. Actually, there is a gap requirement in every procedure because a patient is suffering from the activity intolerance. Am I audible? Hello, am I audible? Am I audible? Okay. Because patient is suffering from the activity intolerance, so when you doing any type of the procedure, then you require gap between the procedure, and you not perform the CT scan first day. You firstly perform the chest X-ray or ECG, then you going to next procedure. Okay, so here is no proper option. I directly explain. Without this CT scan are always performed in the radiology department, and chest X-ray and echocardiogram can be done at the bedside. We can also perform these procedure bedside, but CT scan always perform in radiology department. CT scan can't be done your bedside, patient bedside. Firstly, we perform chest X-ray. So I hope you understood this question. And the next question is, a client is scheduled to have percutaneous transluminal coronary angioplasty, means PTCA. What information about the balloon temperature should nurse to include by providing client education concerning the procedure? Actually, a patient scheduled for the PTCA. What is the PTCA? PTCA means percutaneous transluminal coronary angioplasty. Actually, when the patient is suffering from the any type of the atherosclerosis, then we introduce the catheter at the site of the atherosclerosis, and then when this catheter reaches the site of the atherosclerosis, then we inflate the balloon that present in this catheter. So this balloon suppress or compress the atherosclerotic plaque, and then there is a dilation of the artery. So there is a regain of, or there is a supply is regained in your artery, so patient suffering is reduced. So a mesh like device within the catheter will be inflated, causing it to spring open. No, there is no spring. Okay, the catheter will cut away the plug. No, catheter will position the coronary artery to take the pressure measurement in the vessels. Actually, client has just been admitted to the emergency department with chest pain. Serum cardiac enzyme level are drawn, and result indicate the elevated serum creatinine kinase level, trop T level, trop I level, trop T level, trop I level. These are not indicator of the angina. These are the indicator of MI. These are not indicator of the angina. So if in any patient, if the marker means creatinine kinase level, trop T level, trop I level are increased, then these are indicator of the MI. So stable angina indicator are pain, not CK, trop T, trop I are the indicator of the angina. So these are the wrong answer option, and the right answer is MI. because these all value are elevated in your MI cases. Okay. Then today last question is, this is, the nurse admit a client who is in sickle cell crisis. The nurse should prepare, 1 minute please. Yes. The nurse admit a client who is in sickle cell crisis. The nurse should prepare for the which intervention as the priority in the management of this client. Actually, Ben, what is the sickle cell crisis, sickle cell anemia? Actually, in the sickle cell anemia, if there is reduction in the oxygen level in your blood, so due to the reduction in or reduced amount of the oxygen, the your RBC change the shape in the sickle shape, flow of the blood in the any vessels. So there is a crisis condition happening. So to prevent the crisis situation, you require to, yes, you require to proper uh, proper dilution of your blood and proper oxygen supply. So pain management with opioids is not required here. Actually, intravenous fluid therapy is required, and blood transfusion, no, blood transfusion is not required. Actually, intravenous fluid, what do fluid in your body, actually your fluid dilute the blood and reduce the concentration of the blood, so there is a less clumping of the less clumping of the your RBC with each other, so the crisis is reduced. So you provide the intravenous fluid therapy. Actually, here is one mistake, that second option is repeated in third, so not confused with this option. This is the same option, intravenous fluid therapy. Okay, so right answer is intravenous fluid therapy is prescribed for this patient. So I hope you understood this 10 questions of your exam for DH exam. Okay, thank you so much, and we